We started our business in 1985, myself and my wife, and had one employee. By the time we started to expand in 1990 and had 4 or 5 employees, we recognized sort of a moral obligation to provide for children of my employees, for my employees themselves, to be able to have reasonable health care coverage. And in 1990, it was not a killer yet. We started out probably $130 a month or so. And even by 2002, we were somewhere in like the $250 a month. And then, like so many employers my size, we started to get the 10s and the 12s and the 17s, and maybe it was only 8 this year, and maybe it's 22 next year. And, you know, as you try to plan growth for a small business, as you try to move from $2.5 million a year, $3.5 million a year, to $4 million or $5 million a year in sales, and you try to work those costs into those revenue streams, you want to expand, you go to the bank, take out a business loan, and you know what your payments are going to be for the next 5 years, so that you can plan for that. You sit down, want to talk with key employees about compensation packages. Well, you can talk about what starting rates of pay will be. You can have reasonable expectations of what an annual review might result in, and what they might see over the next 2 to 3 years based on the growth in revenue. And then you have healthcare costs. And year over year over year, and it is only year over year over year, can't find anybody to talk to you about 24 months, can't find anybody to talk to you about 13 months. So what happens? Well, you have your coverage, and 11 months goes by like that, and suddenly something comes in the mail, and you got 4 weeks now. And here's the increase, and for us this year, it was a 26% increase. So we've got 4 weeks now, and what do we have to do in those 4 weeks? Well, now we've got myself and my office manager, who wears about 18 different hats in my organization, one of those being human resources. So what do we have to do? Well, we're presented with Aetna's PPO renewal at 26%, Aetna's new managed care choice, Aetna's new HMO, Aetna's new HSA, Humana's HMO, HSA, and whatever they call their PPO product right now, and a whole multitude of others. And now we've got to sit down, and we've got to tear through this stuff quickly, and we don't have the advantage of having Chuck Gintz there, who understands this deeply, because I suppose if what we want in this country is to have employers like myself, we shouldn't be spending our time thinking about innovative solutions to business questions that will enhance our productivity. We guess I shouldn't be thinking about how to make my products better for my clientele. I shouldn't be thinking about how to make my work environments more productive and better for my employees. No, I should be taking my time and sitting down with my key personnel and spending hours and hours and hours tearing through how we mitigate the cost of a 26% annual increase. So we have to deal with all of this in about 5 or 7 days, because if we're going to make a change, we've got to gather up all the health histories right away. We've got to get those things in, and then we've got to write a check for the first month's premium along with those health histories to the new insurance company. So what happens, and what tends to happen, is instead we say, well, I guess we'll just absorb the cost and we'll figure it out. Or we can't quite absorb the cost, so let's just reduce the coverage and pass some of this along to the backs of our employees. So we danced this dance for the last 5 or 6 or 7 years. And then this year, we said we just can't afford it. We just can't afford to absorb another 26% increase. So here's what we're going to do. We're going to offer our employees a choice. We're going to offer an opportunity, it's so funny how the phrase is, an opportunity to participate in their own health care coverage, meaning we're going to take money out of their pocket so that they can pay a portion of the premium if they want to stay with the managed care. But we want to give an opportunity also for them to not have to pay any more money out of their pocket. So we gave them 3 choices this year. We gave them the HMO option for which we would still continue to pick up the entire premium. And of course, all they have to do is struggle to figure out if now the narrow choice of providers, the narrowing choice of providers, is going to still work for them. Or they could go to an HSA. So we asked them to get their best fortune-telling abilities out, buy a crystal ball, get some of those tarot cards, and try to outguess what they think they're going to spend on healthcare coverage next year, so that they can take some money and stick it into an account that will allow, for some reason, that money is tax deductible, but if we pay our healthcare coverage right out of our pocket, we have to hit this incredibly high threshold. That's a whole other taxing question. But so we asked them to get out their crystal ball and figure out what do they think they're going to spend on healthcare, stick it into an HSA, and for that, of course, their deductible then would move from $1,000 to $2,500, but they'll get a little bit of tax advantage. Or they could pay $40 a month and continue, not quite with the PPO, because Aetna, actually, for the 26% increase they were giving us, Aetna's not offering that PPO for new providers. Now they have something that they call managed care, and I will tell you, I spent about 8 or 9 hours trying to dig through this stuff, and then sat down with the broker and spent about another 6 or 7 hours trying to figure it out. I have probably missed, even at that, quite a bit of what the difference is between the PPO and managed care. When I talk to my competitors, when I talk to friends of mine that own businesses, it's this whole scenario. When I ask them, so what's happening with healthcare coverage for your employees? I get from every single person I talk to the same 3-word answer. It's a mess. And nobody's got time to really deal with it. Not at the level that we need to concentrate on running our businesses, controlling our costs, working on marketing, and talking about how we increase our value in the marketplace and still make a profit. So, I guess where does that leave us? For me, I think it leaves us with a question of whether or not in the United States of America we believe that health care is a fundamental right or a privilege to be enjoyed by few. I think it's rather obvious that with 47 million uninsured Americans and more slipping under, that there's a collective attitude in this country that it's a privilege. I think that it is unconscionable that the finest healthcare system in the world, for some, does not produce the #1 lowest infant mortality rate in the world. And it doesn't even put us in the top 20. We're going to get through the next year in my business. We'll get through all the next years. I guess the question is going to be, what's it going to mean on the backs of employees? I employ people that make $80, $90, $100,000 a year, but I also employ people that make $10 or $11 an hour. And as we continue to shift those costs onto the backs of those individuals, as we continue to try hard to move some of those costs off to our customers, I just don't really know where it's going to end. For me, personally, I only see one answer, and that's let me stop paying 1.65% of my payroll to Medicare. Let me double it. Let me triple it. I'm paying almost 8% of my payroll right now in healthcare premiums to insurance companies that have 18 to 30% overhead costs. Quadruple what I pay to Medicare. And let the 3% coverage in Medicare cover my employees, and let employers who don't have the wherewithal currently, or the social conscience, or the concern about their employees, or the priorities that SCA has for their employees, let them participate as well. I don't know what the answer is, but that would be my answer. Thank you.